Cough. Let us say about a cough. This is a reflex reaction designed to keep your airways clear. You may be coughing because of another condition like asthma or the respiratory infection, or because you have swallowing difficulties. Your healthcare provider can help you figure out what's going on. So, a cough, this is a natural reflex that is your body's way of removing the irritants from your upper throat and the lower lungs airways. Your cough helps your body heal and protect itself. What are the types of cough? There are many types of a cough. Some of the names for the cough describe how long they last, while other types describe how they feel or sound, and other types are actual condition. Types of cough may be related to how they last. Acute cough, they begin suddenly and last for 2 to 3 weeks. Subacute cough is the one that stays around after you had an infection and lasts 3 to 8 weeks. Chronic cough, they last longer than 8 weeks. Long lasting coughs may also be called the persistent cough. Refractory cough is a chronic cough that hasn't responded to the treatment. Types of cough may be related to mucus. A productive cough or a wet cough is a cough that brings up the mucus of the phlegm. A non-productive cough or the dry cough doesn't bring up the mucus of phlegm. Type of cough that have the distinct sounds and are related to specific condition. Whooping cough, pertussis. This is a whooping cough. This is an infection that causes a cough that sounds like a woof. Barking. A cough that sounds like a barking can be a sign of croup. Wheezing. This type of cough most often happens when you have blocked airways. It can be associated with an infection like cold or the chronic conditions like asthma. Types of cough related to when you cough. There will be a daytime cough, nighttime cough, and the cough with vomiting. This often happens with the children. They cough so hard that they gag, and sometimes they will be vomiting. So, here we can look who is more likely to experience a cough. Anyone can get a cough. A cough is the most common symptom reported in the healthcare provider offices. However, some people are more likely to get a cough than others. These include those who have just smoked substances like a tobacco or marijuana. They have a chronic illness, especially those inviting the lungs or the nervous system, like allergies. They are also affected by the children. Kids get sick often, especially if they are in the daycare or school. So here we can look what are the most common causes of a cough. There are many things that can make you cough. Some of them include the irritants or the allergens like smoke, strong smells, mold, dust, pollen, pet dander, mucus, and the certain medications like the blood pressure medication known as ACE inhibitors. And the medical conditions that causes a acute and the subacute cough, cold, flu, acute bronchitis and the bronchiolitis, sinusitis, pneumonia, whooping cough, which we can call it as a pertussis, asthma, allergies, subacute and the second or the third hand smoke exposure. Here we can look for the medical condition that can cause us the chronic cough, chronic bronchitis, asthma, allergies, chronic obstructive pulmonary disease and other lung conditions, gastroesophageal reflux disease, throat disorders including the vocal cord disorders, postnasal drip, heart failure and other cardiac conditions. Here we can do what can be done to control or relieve a cough. Treating a cough will depend on what is causing the cough. If you have an infection, your healthcare provider must prescribe some type of antibiotic or the antiviral medication. But most viral coughs do not require the antiviral medication. For GERD, they may suggest the diet changes or prescribe a proton pump inhibitor or a H2 blocker. Water can be a good for a cough. Drinking it can help ease a cough from the throat infection or the dryness. Adding it to the air with a vaporizer or the steamy shower and other ways water relieves the cough. Quitting smoking and avoiding the other irritants are also the way to relieve a cough. Those irritants may include the medicine scents like perfumes or the candles, smoke or the allergens. What are the counter treatments can I use for cough? There are the plenty of cough syrups and the cough medication available over the counter for adults. In general, they have not been shown to work better than a spoonful of honey. Cough drops and butterscotch Hot candies can help smooth your sore throat. You may also get relief from the hot beverages like tea, especially if you put honey in them. You shouldn't give cough medicine to a child if they are under 6 years of age without the approval of the healthcare provider. Here we can look how can cough be prevented. You can prevent some kinds of cough by avoiding irritants that you know cause you to cough. You can help prevent the coughs caused by infections like getting vaccinated for influenza, COVID-19 and the pneumonia. Avoiding the people who are ill. Avoid touching your eyes, nose and mouth. Washing your hands often with soap and water and using hand sanitizers. Here we can look for the dry cough. They commonly follow on respiratory illness such as cold and the flu. These coughs develop when there is a little or no mucus in the throat. A person may feel a ticking sensation in the throat and they cannot be able to stop coughing. In most cases, the cough goes away in its own. However, there are other causes that people can investigate if a cough becomes chronic. Asthma. Other symptoms like a tight sensation of the chest, shortness of breath, and wheezing. Gastro is a facial reflex disease. This is when the stomach acid travel up towards the throat, which can trigger a cough. Lung cancer. A cough that is related to lung cancer may coincide with the blood in the mucus. It is rare that cough is due to the lung cancer, but if a person is concerned, they should see a doctor. Here the treatment is a person can ease the tickling situation by a dry cough by drinking a water, taking a cough drop and using the cough syrup. Wet cough. People might describe a wet cough in a chesty cough. This cough occurs when a person coughs up the mucus of phlegm. Wet cough are typically due to the infection such as flu or the common cold or the chest infection. These are different like bronchitis, a condition resulting from the mucus pools in the small pouches in the lungs. Pneumonia, this is when a bacterial infection causes the tissue on the lungs to become inflamed. Non-tuberculous mycobacteria infection. This is non-contagious and can be accompanied by tiredness, feeling unwell and weight loss. Chronic obstructive pulmonary disease. This is a type of lung disease where the common symptoms may include shortness of breath and wheezing. Treatment. Staying hydrated can help a wet cough stay protective and ease the symptoms of a cold. Some people also find the relief from the over-counter cough remedies such as cough drops, chest drops, and the pain relievers. If a bacterial infection is causing a cough, a person may need the antibiotics. Whooping cough, pertussis, better known as a whooping cough. This is a highly contagious bacterial infection. Newborns and people who are not yet vaccinated may develop this illness. A person with a whooping cough typically has a mild cold or the flu-like symptoms. They followed by the aggressive and the painful cough. People with a weak immune system such as the babies may struggle to fight the infection or have the trouble breathing. Those with this infection are most likely to have the 2-week rest from when they begin the coughing. The best protection against the illness is whooping cough is vaccinated. Treatment is taking the antibiotics early can decrease the severity of a whooping cough. So an unvaccinated person should see a doctor as soon as possible. Choking. A person may cough if they have a partially blocked airway and the body tries to get rid of the object. Likewise, a person who eats something large or something that irritates the throat may cough. It is advisable to call a doctor if coughing persists after the choking episode. A person who is choking severely will not make a good sound when they cough. Sometimes who stops coughing and is having the trouble breathing may be called choking. Chronic cough. A chronic cough is a cough that lasts longer than the typical illness, usually 8 weeks or more. This cough sometimes signals an underlying disease. A person should see a doctor for the appropriate diagnosis and the treatment. Some potential causes of the long-term cough include an untreated infections or the respiratory virus that lasts longer than the usual allergies. Smoking, exposure to irritants such as mold or dust at home or work. Pneumonia or another lung disease, throat or the oral cancer, swallowing disorders, they caused by the other conditions including the dementia. Summary. Coughing can be scary and may trigger the fears of choking. But if a person can cough, they are passing at least some air through their respiratory tract. In most cases, a cough may clear on its own, although chronic coughs and the cough in young children and unwell seniors warrant the prompt treatment. If a cough sounds bad, it is very painful, or does not go away, people should see a doctor or other healthcare provider as soon as possible. Thank you.